Welcome to Mental Healthy, the podcast where we share stories of the professionals and experts worldwide working in the mental health field. Here's your host, Dr. Kenyon Knapp.
Well, welcome everyone to the Mental Healthy Podcast. I'm glad to have you with us here today. I've got a special guest, Dr. Karin Dumont, and thank you for being with us today.
Oh, thank you for inviting me.
I appreciate you coming. Now, I know we're going to talk about addictions counseling today and some of the ethics and legal issues related to that, because you did a really good presentation on that recently. But before we get to that, though, it's always good for listeners to know where you're coming from and your background a little bit. So could you share with the listeners a little bit about yourself?
Sure. I'm currently working in the School of Behavioral Sciences as a professor, and my background was in addiction counseling to start with. So I came into counseling actually with a bachelor's degree in the TASK program, which at that point was Treatment Alternatives for Street Crime. It's now Treatment Alternatives for Safer Communities. But back in the day with addiction counseling, a lot of people came in with GEDs and high school diplomas. So I was actually quite ahead of a lot of my peers with having a bachelor's degree. So spent several years doing addiction counseling with that program in intensive outpatient, and then moved from there into the DUI program. So did some DUI counseling, and then went into detox crisis stabilization, and then outpatient, working with individuals dealing with more advanced stages of mental illness, such as schizophrenia and addiction. So that's pretty much my background with addiction counseling.
Oh, that's great. Now, with your addictions counseling background, have you specialized in like mainly one type of addiction, like cocaine addiction or alcohol, or have you dealt with lots of different kinds of addictions?
Lots of different types of addiction. Initially, I was working with the criminal justice population, so the offender population. And like I noted, intensive outpatient, where with the TASK program, we were supposed to be case management, but my clinical supervisor, she'd come to us from Hawaii. She was a military spouse, as I was, and she decided case management didn't really make any sense for just our program itself. We would refer out, they'd come to us, we would screen them, refer them out to an intensive outpatient program. And she's like, this doesn't make sense. Why not be one-stop shopping, as she referred to it? Probation, parole, the court system referred them to us. And she said, let's develop an intensive outpatient program. So we put one together and went from there. So, yeah, very interesting that we just decided we were the only TASK program in North Carolina to actually have our own intensive outpatient program. But absolutely positively love doing intensive outpatient with the criminal justice population. As I tell my students, you either absolutely love addiction counseling or you can't stand it. There's pretty much no in between.
Yeah, I've heard that before too. That makes sense. But well, I'll tell you, I heard part of your presentation about addictions work and ethics and legal issues and all that. Could you maybe kick us off with a little bit of, description or delineation about the differences between ethics, morals, and legal aspects of addiction counseling?
Sure. Well, morality, as I think of it, is probably even more profound than ethics. That what plays into that is an individual's personal beliefs about what is going on with an individual. And that could be with addiction counseling. That could be even with mental health counseling. But when it comes into play with addiction counseling, a lot of times people have specific thoughts as to addiction. And that can either go one of two ways. It could be positive or it could be negative. And we have to be very careful when it comes to counseling to not let our personal beliefs play into how we treat our clients. But like I said, it could be positive or it could be negative. We could decide that this is the person's own choice as to why they developed the addiction. I caution my students all the time on this when it comes to teaching them about addiction and saying, not necessarily is it always a choice. I worked with clients who from the time of 7, 8 years old were introduced to the drug, often introduced by the drug or the drug that they started using by a family member. And so by the time they were 10 years old, they were addicted. But instead, also you can look at it morally as, here's this person and they're redeemable. Although that they've started using, everybody has the ability to change. So we also have morally the thought that everybody is able to change. And that could be part of our moral code as to, I see this person as an individual who's able to change. Now, ethics more refers to the principles, understanding that we have guides to our behaviors. So in our particular profession, we have codes of ethics, and that's what guides us in the counseling that we do. So they come to us through, say, possibly the organizations that we follow, such as the ACA or even NADAC, the National Association for Alcoholism and Drug Abuse counselors. So definitely with addiction counseling, we tend to follow the NADAC Code of Ethics, but it can also be the ACA Code of Ethics. And so those are our ethical guidelines that we follow. That will affect our confidentiality, our informed consent with our clients, dual relationships, because there's a lot that comes into play with dual relationships with addiction counseling. It's going to impact the competence, or how we see competence, how that guides us, and also non-discrimination. Both come into play with mental health counseling and also addiction counseling. So those are guidelines that we follow with both of those, but there's a little different play when it comes to addiction counseling in those areas. For instance, when it comes to dual relationships, you see a lot of that in addiction counseling because of the fact that, as I noted, when I started addiction counseling, we had individuals that were there with GEDs or high school diplomas. Well, a lot of those individuals had come into addiction counseling because they were in recovery themselves. So that's how they started in addiction counseling. Well, when you're in recovery yourself, there's a strong possibility of being in a dual relationship. They may be going to support group meetings, and they will be there alongside clients or individuals who are coming to the same agency to receive counseling. It may not be their specific client, but they're walking into the agency to do counseling with other clients, and there's someone they've seen in what's referred to as the rooms, the support groups, AANA, and there's an individual that they've sat in those meetings with that is now also a client at the agency they work for. So we have to be very adherent to our ethics codes.
Yeah, that makes sense, because I can see how that could get messy pretty quick if you were at your own support group and all of a sudden your client walks in. That definitely dual relationships there, but at the same time, I sort of think too, I mean, you know, the counselor at that point, even though they're being a client in that setting, they are modeling good behavior for the client as well about, you know, your sobriety and all that, what you do to maintain your sobriety.
Now, hopefully, they are. What has tended to happen sometimes in the past, and I've seen this happen, is we've had counselors who have relapsed. And that can definitely affect some of our other clients, of course, when they watch a counselor who they've seen for years and years and years in recovery, and then suddenly that counselor relapses. So that's difficult for then the clients to go through. It's almost like a mourning process or a grieving process, because, well, if they can relapse, anybody can. And we know that. Relapse is part of addiction. It's, I would say, rare that you don't see it in individuals going through recovery, that they don't relapse at least once. Sometimes frequently that there's relapse, but that really hits clients hard when it's a counselor that they've seen that's been doing well and possibly even years and years of recovery, and something happens and they relapse.
I guess at that point, your perspective on relapse comes into play too. Like, do you view it as post-traumatic growth, sort of like, am I going to learn from this experience? Or is it just shame-based at that point? Like, oh, you just screwed up and, you know, you're like a failure or something like that.
And then that comes back to the moral aspect. You know, how do you then fold that in? And again, it can be used positively or negatively. So we don't have to shame our clients as to, well, you know, you did horribly, you didn't do well. It's okay, let's build from this. And that's where the relapse prevention plans come into play with our clients. It's like, okay, going forward, how do we build from this? How do we go on? Whatever was we had put into place with your relapse prevention plan, let's revisit this, because it obviously wasn't effective enough. Doesn't mean that it wasn't effective to a point, but now let's go back. It's like with any treatment plan that you have in a mental health client that, okay, something wasn't working, something wasn't 100% spot on. So let's go back to it. And maybe you need a different form of treatment. Maybe you're intensive outpatient and we need to look at inpatient. And once you're done with inpatient, then you come back to us. Maybe you need more support group attendance. You're doing intensive outpatient, you're doing therapy, but we need to increase the support group attendance once you're outside of here. Maybe we told you or recommended to you to get a sponsor in support groups. And I'm checking with you, did you get that sponsor yet? So when you're not with us and you can't reach me on a Saturday or Sunday night, you can contact that sponsor. Did you ever do that? Well, no. Okay, well, let's look into that and make sure that that's being followed through on. So again, instead of shaming them, it's like, how do we build them up?
Mm-hmm. Well, it strikes me too, like you were saying earlier about the Christian worldview and helping redeem people and viewing them as being made in the image of God. Like if people mess up, whether it be us or the client, if we can know that God forgives us and we can forgive ourselves, hopefully that the addiction cycle becomes shorter as far as people not, wallowing in their shame and guilt and all that. If they can sort of get back on the train, and
right. That was a big part when I came into addiction counseling. Oh, good grief. I hate to say the year, but it was 1995. So when I came in, it was still called reality therapy, which now is choice therapy. They've even changed the name. But I refer to it as hitting someone over the head with the big book, the AA big book. Yeah, because that was pretty much, it's like, okay, you're going to get clean and sober. So that was very, the morality came into play there. So it was moral, as opposed to the disease. Although we said that we believed in disease and the disease theory, we really didn't. It was more shaming. It was, you're going to get clean and sober and we're going to drag you through this. And thankfully, motivational interviewing came in. We moved from reality therapy into cognitive behavioral and then into motivational interviewing. So how do we help them to find something that's going to motivate them? And I even saw, that was pretty much with my clinical supervisor. She's like, find a hook for them. So she was ahead of her time. Again, they would come into my office and so many times because they were referred by the court system, probation, parole, and they would say to me, well, I have to be here. I don't want to be here. I have to. And I'm like, no, actually, you don't. You had a choice. So again, I'm going, well, we are actually trying to motivate them even back then with, you could have gotten up this morning and decided not to come. And they're like, no, my probation officer told me I had to. Well, you could have decided not to and made the choice to go to jail. And that would have been it. But yes, there was still a choice. And they're like, yeah, you're kind of right. And I'm like, so give yourself credit for coming here instead. And I said, so since you did make that choice, what do you want to get out of this? And they're like, okay, instead of having to be here and having to not get anything out of it, what can we do so you get something out of this?
That makes sense. And I love the way you're sort of putting them in control again, instead of them just playing the victim the whole time. That's certainly an empowering idea. Well, let me ask you this. I mean, we started out here talking about ethics, morals, and legal issues about addictions counseling, but I know here at the university, you teach both clinical mental health counseling and addiction stuff. So what are some of the differences between those two fields? Because I know, both of them have specializations and certifications and all that stuff. Like, how do you compare them?
Well, I think one of the aspects that's different is with the mental health side, you don't get as involved with the addiction aspect. When I, again, coming into the field or the profession way back when, mental health really did not want to deal with the addiction side. And I still think that that's pretty common, is we always refer to ourselves as the redheaded stepchildren on the addiction side. It's because our mental health center was divided with, there's the mental health side, there's the addiction side. And if a client came in and even said they were drinking one beer, and again, it's like, well, how big? A 12-ounce beer, I mean, there's a lot of people in society that will have a 12-ounce beer once a week. They would be like, okay, go to the addiction side and talk to them. They'd come over to us, we'd screen them and be like, okay, well, that's one 12-ounce beer. Maybe you need to go back to the mental health side. But it's important for both sides to be able to do a proper assessment. But we would deal on the addiction side, we deal a lot more with the dual diagnosis. So with mental health, you don't deal with that as much. However, I think it is essential for the mental health side to be able to assess well. But they're not going to have that dual diagnosis going on and need to treat both sides. They're going to deal with the mental health side and know how to deal with those aspects when it comes to the clinical counseling, and not really have to focus on what's it like to treat someone who's dealing with both. And as I try to have my students focus on, make sure you're doing that thorough assessment when I'm dealing with, say, our psychopathology class, and I'm teaching that and they're assessing, because it's essential to make sure that you know even which came first. Because a lot of times clients will, when they're dealing with a mental health disorder, they'll utilize the substance to handle the mental health symptoms. But sometimes the mental health symptoms are coming from the use of the substance. As you noted, as you asked in the beginning, was there any specific substance that I was treating? And nowadays, I mean, you're pretty much dealing with all of them, and you have to know all of them. I was just working on a book chapter, which my eyes got blurry after a while with, cocaine and fentanyl and ketamine and GHB, gamma hydroxybutyrate. I mean, all of those. And there's even ones that they're coming out with now that I don't even know of, that they just make. But so many of those substances you will see mental health symptoms from. So if we don't assess well, we may just assume that the depressive symptoms that they're exhibiting are, or the anxiety symptoms, that they're being caused by the mental health illness, and we're not realizing that they're actually coming from the substance that they're using. So mental health side needs to be able to assess well, but even on our side, on the addiction side, we need to be able to assess well to know, is there an underlying mental health condition that in time, once we get the person clean and sober, we have to ensure, first of all, they're clean and sober, because those mental health symptoms may go away once they're clean and sober. A lot of times, though, you will continue to see, say, personality disorders. But again, let's not diagnose until we get them clean and sober, because we don't know if it's going to stay. So those are some of the big ones. There's also legal aspects that you're going to deal with on the addiction side that you're not necessarily going to deal with on the mental health side. For instance, dealing with probation, parole, court-mandated clients. So you have to handle a lot of that. And we've got 42 CFR, Code of Federal Regulations, Part 2, that we have to follow. A lot of individuals don't realize, and I try to get my students to understand this, that 42 Code of Federal Regulations, Part 2 actually holds addiction records under much more confidentiality even than mental health records. So we would actually have to, if we were subpoenaed into court, we couldn't just release the records to a judge. We had to be put on the stand and required to break confidentiality. So that's another aspect of the legal areas that is different than the mental health side. It's important to be pulled into court, have the judge say you have to break confidentiality. But there are times that you're going to have to reveal stuff to a probation or parole officer with a release of information. And your clients know that. So they're coming in, they've been court mandated, there's things going on. So they may be doing urinalysis with you so that you can check for their drug use. And now you're going to have to report back to their probation parole officer, yes, they've tested positive. And that can impact that relationship. That therapeutic relationship that you've developed. So that's different than having developing that therapeutic relationship with a client that you're just you have in mental health counseling. Whereas now you've got them in addiction counseling. They're coming in for their next session and they're sitting there, they're kind of like backed up. And you're going, well, I think I know what this is about. I just had to report to their probation officer that they tested positive, but I'm going to use my skill of immediacy here and be like, so I noticed last session you were pretty open with me, and now this session, not so much. What's going on? And they're going to be like, well, you told my probation officer I was using. Yes, and we discussed that at the beginning of treatment, that if you tested positive, I was going to have to. Confidentiality is a big thing. Getting the legal system to understand that there are times that they can't just barge over into, because we actually had a building that was linked with probation parole. So probation parole was on one side of our building, we were on the other side. And I had to set firm rules down, and they abided by them. They were great, but I'm sure other places it isn't. They were not allowed in my group room. Nobody was allowed in my group room. But they weren't allowed even back there, because there were times that they would come over and stand outside the door into our building to arrest people. They just would have to, because they had broken their probation for various reasons. But they knew you can't do it outside the group room. You can do it out front of the building. Because of the whole concept of, we want it to be a safe place. Groups should be a safe place. And they were like, we get it, we understand, we'll follow those rules. But again, some places, I'm sure they're not as willing to follow that type of a situation.
Well, this is good. I love the fact that you've done so much of the real thing, because our listeners are mainly faculty and graduate students in the mental health fields, and this is all real practical stuff. I mean, you're touching on so many ethical issues here. I mean, confidentiality, dual relationships, maintaining a therapeutic relationship in the practice. Are there any other big ethical issues that are common that you see in the working with this population?
Let's see. I'm trying to think of what some of the other ones are. We've got dual relationships. Competence, I guess, would be a big one. Making sure that you are competent in what you're doing. Like I noted, when I came into the profession, I had a bachelor's degree. And again, it was allowed. Nowadays, they really are pushing more, for most states are. You have to have at least a bachelor's degree. I have seen, though, with some states with the CSAC, the Certified Substance Abuse Counselor, you can still have a high school diploma or GED having been grandfathered in. Now, North Carolina, and I'm in North Carolina, we go up to licensed clinical addiction specialists, and I was so excited when I saw that, because you have to have a master's degree. So we're getting more in line with the mental health side with doing licensure. But when I was doing the addiction counseling, I felt fake. So it's that whole, imposter syndrome. I kept waiting so many times, and I tell my students this all the time, because we know our students deal with imposter syndrome. And I was waiting for someone to come and tap me on the shoulder and go, you got to go home. You don't know what you're doing. And I would have been like, okay, give me 5 minutes. I'll pack up my office and I'll go. Not a problem. So I started thinking about it. I'm like, I need to go back to school and get a graduate degree and actually feel like a real person. So I think it is important for competence to make sure that you have the credentials that you need to provide the treatment for your clients. That's a big deal. And then continue to go on and stay up to date. As I previously had said, came in with choice therapy or choice theory, and we've moved all the way up to motivational interviewing. They're continuing now to use even EMDR with addiction counseling also, especially with trauma and addiction counseling. So ensuring that you're competent to provide the counseling to your clients is another big area. I would say that's a major aspect too, would be being a competent counselor. And if you don't feel that you are, making sure you're getting that additional assistance. Supervision's a big one too. Making sure you have individuals who can supervise you. And that even includes not just your supervisor themselves, but mentors. So other peers will be there to assist you. I know, again, when I came into the profession, and a lot of individuals, I've had students share this with me in internships, because I teach the addiction internship classes, and we a lot of times get thrown into agencies where there's not a lot of other counselors, just because of financial issues. So we oftentimes are over our heads with caseload. And it's important to have peers that you can go to and say, I don't understand what I'm doing. I remember doing an assessment or observing an assessment. The first one I ever observed, and then the next one I was handed the folder of all the paperwork and said, you're on, go. And I'm going, I watched one. And they're like, well, that's good. You've watched one. Now you can do it. And I'm going, I don't think I have a clue. And they're like, no, you'll be good. And then we'll go over it with you and you can figure out the diagnosis and the treatment plan. And I'm going, I'm not sure I can do this, but okay. Yeah. And from what I understand, it can still happen because, again, funding, especially county agencies and places like that, funding's not good. So making sure you have mentors that you can go to, other counselors you can go to say, I need help. Speaking out about that, I think, is important. And if we've got supervisors watching, please know that your counselors can be not knowing what they're doing and maybe not even know that they don't know or uncomfortable speaking up. So providing staffing, I think, is essential. At least, the people that I had with me said, we will have people for you to go to. And we staffed daily. The last 30 minutes of every day was bringing your cases in that either you did an intake on or that you were having problems with. So a client that you're like, I don't know what's going on with this person. Like I said, they're relapsing. Give me suggestions. Should we put them at, we had a housing area that they could go into so that they were out of their own home. So it was a dry house. In other words, it's like, hey, you're going to move into the dry house because you're not able to stay clean and sober. So, or that's at least our recommendation, is that you go into this because you're having a difficult time staying clean and sober in your own environment. So that's our recommendation. But we could bring our case into staffing and say, I need suggestions. What do you guys think? So I think things like that are essential. Make sure you're providing opportunities for your counselors and counselors who are out there going into the profession. Look for your resources.
Absolutely. Well, you're giving a lot of great feedback here about, really best practices for how to provide services and what they should have in the practice. And I know you teach students every week, addiction counseling. What's some advice? I know we have a lot of students listening, but what's some advice you'd give to a student who's considering going into addictions counseling? Like, what are some of the ethical dilemmas they might run into, or potholes in the road of addictions counseling? You need to say, hey, watch out for this, or look for this in a practice. What's some advice you might have for a student?
I would say one of the big ones is don't own your client's successes or relapses.
Okay.
So that is major because of the fact that when you own their successes and their relapses, you're going to burn out fast. I had to be very careful of that. I remember my supervisor, my administrative supervisor, it was probably a couple of months after I went into the position, the first position I went into. And I remember him calling me into his office and saying, get off your white horse. And I was like, huh? He's like, you're trying to save everybody. He goes, you can't. He goes, truly, you can't save anybody. It's up to them. And so that's important to realize. You're not there to save people. They're there to save themselves. So you guide them. Again, one of my favorite phrases, and I don't know who came up with this, but I heard it years ago, was, we're not the sage on the stage, we're the guide who comes alongside. And that's what you are, whether it's mental health counseling, whether it's addiction counseling, whatever type of counseling it is, you're the guide who's going to come alongside the person, but you can't save them. And when we try to, again, we're going to burn out quickly, and we're going to take, especially their relapses, really hard. So that's essential, is that we don't do that. Making sure you're following all the guidelines, the ethics codes, but also that you're adhering with any legal compliance, staying within the legal guidelines of what you're supposed to is important. So know the legal aspects of addiction counseling. Like I said, 42 CFR Part 2. I mean, that was drilled into my head that, hey, if even if a judge subpoenas your records, you need to go into court I ask students this a lot of times, if an attorney subpoenas your records, can you release them to them? And students all the time are like, oh, yeah. And I'm like, oh, no, they don't have that kind of a clout. Oh, no, not unless a client has released it and, you need a release of information. So knowing legally what you can do is important. Because, yes, your client may want those records released to an attorney, but again, that goes back to them. So know legally. And the ethics codes are going to help you legally too, because of the fact that they're going to keep you out of court when it comes to anything administratively. They're going to assist you to make sure that you don't, actually civilly, not administratively, but civilly, you don't want to get sued. You don't want malpractice coming towards you, but also they're going to assist you administratively with any board complaints. So make sure you're following those ethics codes. They're important. Make sure you're staying, again, up to date when it comes to professional standards. So CEUs are important. I know students don't want to hear that after you finish, even with school and you have your license, that yes, you have to go on, you have to continue to do education. I enjoy it, but I'm a nerd. But I like continuing to learn. So that's important to continue to get those CEUs and to stay up to date. As I stated before, they're even coming out with all kinds of, whoever they is, but new drugs. They just continue to make them and make them. I'm trying to think. There's this one show that I watch all the time. It's about smuggling drugs across the border, just because I'm like, how are they doing it now? Again, it's like, what are they doing and how are they bringing it in? Because it keeps me up to date even on, okay, that's the drug they're bringing in now. And now I know, what are they becoming addicted to and what's the drug of choice at this point, or drug of addiction? Because truly, I don't think there is a drug of choice. And we even changed the language on that doing addiction counseling. It's not really a drug of choice, it's a drug of addiction. So, because I don't think anybody, again, makes a choice to become addicted. Nobody would put themselves through that. So that's important. Knowing the culture also of addiction and what goes into that is essential. That there is an entire culture unto itself of addiction. And then the little microcultures within that. So the legal system, being in prison is a culture. So a lot of times when we think of cultures, we don't necessarily think of the prison system as a culture. I had to learn lingo, working with a lot of my clients, like trustee. And I was just like, what is a trustee? And that's a person within the prison system who has shown themselves to be responsible. And they got special privileges, and that was granted to them actually by the jail or the prison itself because they were doing what they were supposed to. Being in a gang is a culture unto itself. And I've got an entire book somewhere of gang symbols, gang signs, gang clothing, because I had to learn that working with the criminal justice population. So know your populations that you're working with when you're doing addiction counseling, because there will be multicultures within the addiction culture. Know also that dealing is an addiction. So there's an addiction to that. And I think that's important to recognize that can be very addictive, because you'll have a lot of clients that will come in and they're addicted to a substance, but they also will be dealing. And that is an addiction. Know that there are behavioral addictions. That's a big part of what we're now seeing is the behavioral addictions. And people aren't checking for that. I would say as much as they need to. It hasn't hit the DSM like it will in time. We've got gambling in there. Now, some of them are in there, but they're hidden. I refer to as being hidden because they're in other categories. Eating disorders are addictions. A lot of those are addictions. Hoarding is an addiction. I was talking about several of these with a friend yesterday. We, of course, know the social media is very addictive, but things like gaming. So those are things to start checking for, even say on the mental health side of the house when you're talking with your clients, because you could be seeing anxiety and it could be some of these others. Yeah,
they're all mood altering behaviors. You can modify your mood, or if you're feeling depressed, you can go play video games for 3 hours or go shopping, or you're right. There's so much of that. And it frustrates me, to be honest, that the DSM is totally written by psychiatrists who have that hardcore medical model. And they seem, I don't know if they're ignorant or if they're just resistant to the idea of addiction.
Mm-hmm. There's a fascinating documentary out there. I accidentally found it one night. It was on, I don't know, one of the channels. And it's actually out there. You can find it on the internet. It's called the Marketing Madness. I think that's the title of it. But it talks about how, if I remember right, the individuals, that's the, what it is that the criteria for a lot of the disorders, there's no actual scientific reasoning for how they came up with the criteria. They just got individuals together, like you said, psychiatrists, and they're like, well, I see this when it comes to generalized anxiety disorder. And someone else would say, well, I see this when it comes to generalized anxiety disorder in a person. So, but there's no scientific research behind what the criteria actually are. And I'm going, I had no idea about that until I started watching this documentary, which totally horrified me. And until then, I would say I was a big proponent of the DSM. And then all of a sudden I started having, and I'm kind of wondering at this point, I'm on the fence, but I'm now wondering, going, okay, how did this come about?
Yeah, well, it's sort of a blessing and a curse. Like, we need to use it for insurance reimbursement, but then when you see political agendas in it or things like that, it's concerning. But let me ask you this. You're mentioning so many different topics that are helpful. If there's a student or a faculty member listening and they go, wow, this is great, I'd love to know more about addiction counseling, are there certain resources that you would go, oh, this is the best book on the topic, or the best, I don't know, video or whatever that you would recommend?
I would definitely recommend going to the NADAC website because there's a lot of sources out there. Trying to think of any textbooks or books that I would think of. I would definitely look at Miller and Rolnick's Motivational Interviewing because I would say that is a very useful book for understanding how to treat addiction. So definitely that one. I think, off the top of my head, trying to look at my bookshelf to see what else I would recommend.
That's okay. You can think of some more. I know I sort of caught you off guard a little bit with that one, but let me ask you too. I know you teach addiction counseling at the university. Do you do any trainings on the side or anything like that about addiction counseling?
I've done some for the workshop. I mean, for the conferences. So I've done ones at conferences, but that's about it.
Okay. Yeah, I just want to sort of give you a chance to market yourself. If you,
I just thought of another book that I would recommend: A Gentle Walk Through the 12 Steps.
Oh, okay, I've heard of that one.
Mm-hmm.
Well, that's great. I'll tell you, I want to respect your time and the time of our listeners. So we're sort of getting near the end here. Are there any final thoughts you want to share? Because I know there's things I wanted to ask you about today, but there's always probably something else God put on your heart to share with the listeners. Any final thoughts? I
would say that, as I noted, one of the things that I always, again, try to emphasize with students is knowing that the clients you're working with, when it comes to addiction counseling, it's, for the majority of them, or I would say for all of them, it was not a choice to become addicted. When you listen to their stories and you listen to the backstory behind how they became addicted, because when I did intensive outpatient, and the foundation of addiction counseling is generally group. So we did the intensive outpatient group was 8 weeks long. By week 5, they were doing their autobiographies. And when you hear their autobiography and you hear the story of their life, it wasn't, my question was never, why did you start using? It was generally, why wouldn't you? You listen to how horrific their lives were. And oftentimes, like I noted, they often were introduced to it by a family member. It's always stuck in my head. Probably one of the first clients that shared with me, not one of my first clients, say, but one of the clients that shared with me that, she was about 8 years old and her grandfather was the one who introduced her to drugs, gave her a joint to smoke. And I had a grandfather and a great uncle who chewed tobacco, probably from about the time they were 8 years old on. They used to steal it from their father. And and I grew up in New Jersey, but they chewed tobacco. You would think I grew up in the South, but nope. And I remember always knowing that they chewed tobacco and seeing them chew tobacco. One lived on one side of me, the other lived on the other side, and seeing the buckets. So if I had been 8 years old and my grandfather or my great uncle had handed me chewing tobacco, again, that was my family environment, I wouldn't have thought twice about it. I would have been like, oh, okay, that's what they do. So when she shared that story, it made sense that, well, why wouldn't you? So, I try to get through to my students because a lot of times they can be very judgmental and be like, well, it was their choice. Not when you hear the backstories. And I think that's so important for us to realize. And that, sin came into this world in the fall, in the garden, and God grants all of us grace. So it is so important for us to realize that the image of God was marred in all of us. So we need to be able to reach out to others with that grace and see the image of God still in them, and that all of us can be redeemed. And that is so essential for us to be able to reach out to others and want to see them redeemed, and just to be able to have mercy on them is important. I saw God act so significantly when it came to addiction counseling, the changes he was able to make. And it was all through God and the Holy Spirit. And that's, I've had people ask me over the years, why did you want to do addiction counseling, or why did you stay? Because it was just a very strange story how I got into addiction counseling. It was not by choice. It just kind of was like, hey, this position's open. Do you want it? I was like, sure. But to see God's footsteps through people's lives is just so beautiful. I would definitely say that, when you watch that and you see that, you know that God exists. If you don't see it anywhere else, which I hope people do, you will definitely see it in addiction counseling, how he can save people and give them that grace to continue on in their lives. And one of the stories that most amazed me was I had a group and did not have any clue that this was going to happen. Ended up with someone in there who was in there with their drug dealer. And I was going, yeah. And we never knew. We put the groups together, and then I was like, I prayed. I was like, okay, God, what do you want me to do? And of course, went to the probation officers, like, we need those people in there. We need them both in there because we wouldn't start another group for 8 weeks. And I'm going, okay, but I don't want them in there together. And when the one person did their autobiography and shared what they had gone through and what they had done because of their addiction, the person who was the dealer cried. And I'm going, that's powerful, for him to actually understand that this, and again, they made their choices. So, but he cried, knowing that by things that he had done, this is where she had gone to. And I'm just going, okay, there was a reason. God did this. God orchestrated that. So it just is amazing what occurs.
It's cool. It's cool to hear how God works through those situations. And it's neat to see how God can use you to redeem people like that. And so there is hope in this. I mean, I know some people look at addictions counseling and go, oh, all they do is relapse again and again and again, and they just throw their hands up in the air. But I hear you describing people who do overcome and who do grow to understand God better through their weaknesses. So I hear a lot of hope in that.
Mm-hmm. There truly is. There really is. I mean, I saw people who, one guy, he got cancer. And I would have sworn that he would have relapsed after developing cancer. And nope, he stayed clean. He's like, I'm going to die clean, sober. That was his plan. And I mean, he did, the cancer was, it was not going to go away. It was fatal. But he's like, I'm dying clean and sober. I'm going to my Lord clean and sober. So,
that's awesome. Well, that's a neat note to wrap things up on. I do appreciate you being on the program today and sharing all this information with everyone. If people wanted to know more about addiction counseling past this, would you refer them to NADAC, or would you be open to people contacting you for additional information?
Well, they can definitely contact me. And my email address is just KDUMONT@liberty.edu. I'm so old, I don't even get a number at Liberty.
Oh, that's funny. Well, I know they'll appreciate that, and it helps to have somebody who they can turn to for advice. And of course, God's given you this rich experience of understanding all this through your years of working with it. So that's awesome. So thank you so much for being on the podcast today. I really appreciate it.
Well, thank you for inviting me. I had a great time.
Absolutely. We appreciate it. And listeners, I hope it's benefited you as well, learning from someone who really understands this field and who's helped a lot of people. So go and do the same, let her be a great example to you of helping others and redeeming others. And that's what we all aspire to. So God bless you. Thank you for joining us today. And we'll look forward to having you with us next time on the Mental Healthy Podcast.
Thanks for listening to this episode of Mental Healthy. If you want to hear more episodes, please hit the subscribe button wherever you get your podcasts and head to linktree.com/mentalhealthypodcast for all of our social media platforms with the latest mental healthy content. If you have a story to share that relates to what we discussed in in or any other episode, please contact us at mentalhealthy2020@gmail.com. That's mentalhealthy2020@gmail.com. Thank you, and God bless.